My name's Jonathan Rosand. I'm a neurologist at Mass General Hospital and Harvard Medical School, and I'm delighted to be joining the World Stroke Congress this year in Toronto. The title of my lecture will be Brain Care and Optimal Blood Pressure Management for ICH Survivors. ICH is the most severe manifestation of common forms of cerebral small vessel disease. These diseases, cerebral amyloid angiopathy and arteriolosclerosis, are progressive. For ICH survivors, this progression has devastating consequences. Within 5 years of their ICH, nearly half of ICH survivors will go on to develop a new ischemic stroke or new hemorrhagic stroke, new cognitive decline, or new depression. So what can we tell our patients when they ask us, "Doctor, what can I do to take good care of my brain so that I don't have another stroke, so I keep my memory and stave off depression?" The good news is that there's a lot we can recommend to our patients. Based on accumulated robust data, we can say that roughly 50% of strokes, 40% of dementia, and 30% of depression cases could be prevented through health-related choices and risk factor modification. By taking those steps, ICH survivors can take good care of their brains and reduce their risk of ever having another stroke or developing cognitive decline or depression. At the McCann Center for Brain Health here in Boston, we have developed a brain care score for patients to use. The higher your score, the more you're doing to prevent stroke, cognitive decline, and depression. For people who have survived an ICH, there's one component of the brain care score that has the highest impact on their future brain health. That's blood pressure control. And for ICH patients, lower is better. Optimal blood pressure means less than 120/80. In my talk, I will address the evidence linking blood pressure control to preservation of brain function for people who have survived an ICH. I'll offer current recommendations and describe the latest research into how best to achieve optimal blood pressure control, the cornerstone of brain care for ICH survivors. I look forward to seeing you all in Toronto.